The governors of both New York and New Jersey have announced a mandatory and automatic quarantine for doctors, healthcare workers, and passengers returning to their states by air after having contact with Ebola patients in West Africa. The decision comes after New York reported its first case of the virus. CCTV's Liling reports from New York.
Yes, Elaine, a 21-day quarantine for a disease that has a 21-day incubation period. That's the latest from the governors of New York and New Jersey, and it is effective immediately. Now, the policy applies to all passengers who have been in contact with Ebola patients in the West African countries of Sierra Leone, Guinea, and Liberia. And it also, it basically means that if they travel to New York and New Jersey via the airports, John F. Kennedy Airport and Newark Liberty International Airport, they will be subjected to this quarantine. It is also a more stringent quarantine, a more stringent policy than what the federal government requires in its 3-week monitoring of travelers who are traveling from these Ebola-stricken countries. It also comes, as you said, as New York City sees its first case of Ebola, and also amid officials' assurances to the public that there is limited risk of exposure.
At the Bellevue Hospital in downtown Manhattan, the first Ebola case in the country's most populous city is being treated in isolation. Behind these walls, Dr. Craig Spencer remains in stable condition, and city officials say he poses no threat to others.
The capacity of our medical community to address this issue is extraordinary. And again, you're talking about Bellevue, which is one of the world's most capable hospitals when it comes to challenges and crises.
New York Mayor Bill de Blasio said events unfolded in line with protocols, from the patient notifying public health authorities and his transfer to the hospital to steps retracing his whereabouts in the days before he was symptomatic. The patient's fiancé and 2 of his friends are under quarantine. 33-year-old Spencer is a New Yorker who was working with Doctors Without Borders to treat Ebola patients in Guinea. He returned to New York a week ago. He began presenting symptoms on Thursday morning, including a fever of around 38 degrees Celsius, along with stomach discomfort, nausea, and fatigue. Authorities say Spencer visited a bowling alley, used the subways and a taxi service in the days before he showed symptoms, but they assured New Yorkers that the disease can only be spread through the exchange of body fluids. New York officials are going to great lengths to keep the public informed about developments here at Bellevue Hospital and also across the city. And we're hearing 2 key messages repeatedly. The first is that the city is fully prepared to deal with this. And the second is that Ebola is not airborne. It cannot be spread through casual contact. So New Yorkers have no need to panic or change their daily routines. Despite assurances, New Yorkers have mixed feelings.
I haven't really been super conscious of, what I'm touching or if I'm hand sanitizing or who I'm talking to or who I'm shaking hands with. Hasn't been in the forefront. I guess it should be more.
I'm not afraid because I got confidence in New York City and Bellevue Hospital.
A Columbia University professor of epidemiology says there is no risk to New Yorkers.
Well, all our experience suggests that until someone really feels sick and starts excreting, there's often a bloody diarrhea or blood coming from various places. Until that happens and the temperature goes up, that person isn't able to transmit the infection to anyone.
Dr. Moore says New York health officials took the proper steps in dealing with this case.
Even so, there have been concerns among some officials and members of the public about how the doctor was out and about in the city despite having been in contact with Ebola patients. And much of this outcry, we saw on Twitter, on the social network Twitter, with one Twitter user saying that the doctor has had more of a social life in the past 4 days than she had in the past year. Elaine?
All right. Well, Liling, the mandatory quarantine also raises questions and concerns, doesn't it? Because how affected would it actually be?
Well, there is one side of the argument that said had this doctor been quarantined, it would have officials would have detected this case sooner, and that would have reduced the risk of exposure to 0. But the other side of the argument is that this policy is unnecessary because people are not contagious until they're symptomatic. And a lot of this argument is coming from aid groups, including Doctors Without Borders, which the doctor was working with, which this patient was working with. And the other concern is that it would deter health workers from volunteering to travel to these Ebola hot zones to help fight the epidemic at its core. Elaine?
All right, Liling for us live in New York.